November is National Diabetes Month, and Dr. Brian Berry, the medical director of the Grand Rapids Eye Institute, is in today to talk about diabetes and how it can affect the eyes.
I have to be honest, Dr. Berry, I didn't even know that the eyes and diabetes had anything to do with one another, but there is a very big connection.
Very common, but you know, it's surprisingly, I hear that all the time from patients. Diabetes, the most common thing is blurred vision. Patients will come in and they have a sudden change in their vision, and it's due to the sugar being too high or even too low. It causes the lens on the inside of the eye to swell and change your vision. Another common thing that we'll see is when the blood vessels affect the little nerves that affect the eye muscles, it causes them to have sudden onset of double vision.
Okay.
And more serious, the blood vessels can sometimes leak into the retina, and the blood and the blood proteins can leak into the retina, causing much more severe damage.
So is that something you can spot during a routine, that yearly eye checkup?
The yearly eye check, it's very, very much so. It's a visible thing, so you can, it's either there or it's not, but it's something that we can look in the eye and readily identify.
So you're going to have some problems if this is starting to affect you. You said the double vision and blurriness, you know, but what can something be done? Because our vision is so crucial, it's so important.
Oh, absolutely. You know, there's a lot of things. The first two that I talked about, usually tincture of time and good control of their blood sugar, getting into their primary care physician, making sure blood sugar is under control, will usually take care of those first two problems. However, on the second one, if there's any leakage of blood protein, there's good laser treatment. But again, laser treatment is only good if we get to patients early. And unfortunately, you would think if there's a little bit of blood in the back of the eye, they would notice it.
Right.
Unfortunately, patients really don't notice it until it's pretty moderate to severe.
Okay, all right. And so then you work in conjunction with the patient's primary care provider to make sure you're getting that blood sugar controlled.
Absolutely. And not only good blood sugar control, they also have to keep their blood pressure under good control as well.
So there are a number of different ways they can do that. Medication, insulin. I know so many people that suffer from diabetes. It's very common, actually.
It is real common. The most important is diet and exercise. There are many patients, if they really watch their diet and they exercise well, can really control their blood sugars. But if that's not adequate, then there's oral medications, several different oral medications that their primary care provider can work with them to find the right one that'll control their blood sugar.
You know, and it's really interesting because you know, obviously you've been in my life for a long time because you did my LASIK surgery several years ago, and we talk about just that important relationship to have with your eye doctor because they're really the windows into your whole body.
Right, we can tell a lot in a lot of different disease processes, but you know, that annual exam, whether you're having any problems or not, we can detect a lot of things.
Yeah, so it's important to go in and have that exam. I have to admit, I don't, because I don't wear glasses, I don't wear contacts, and so I wouldn't come in unless it's a problem. But you've detected these problems for people who've come in and had blurriness and said, hey, and kind of got them on the road to getting
and a lot of
treatment
times
for diabetes.
They're just like you. They've never had a problem, and they only come in if there's a problem. And then we look at their eyes, and if they've had a big change in their vision, well, you know, let's check for sugar first before we give you a pair of glasses or contacts.
Well, that's great. Okay, now we're going to be talking about there actually is a big giveaway that you're doing to help maybe give somebody an early Christmas present.
Well, yes, we are. It's the free LASIK giveaway for charity for Welcome Homes. And there's just one more week for this. And all the details are on our website at www.grandrapidseyeinstitute.com or on our Facebook page where we've had them all laid out. But it's a wonderful thing. It's a win-win situation both for LASIK patients as well as for Welcome Homes.
They do a great job there, Welcome Homes. I've had the opportunity to speak to that organization in the past, and they just do wonderful, wonderful work. And obviously that's a cause that's near and dear to your heart.
Oh, yes. It's a wonderful thing that we can help them because they do so much for these patients.
So stop in, get your consultation, make sure you're a candidate. People can also find you on Facebook as well and get that information. We can hook it up to make it easy for them to get to you.
Oh, wonderful.
We appreciate that because I understand the big announcement's going to be on the 19th that we're going to be announcing the winner of this.
That's right. That's 2 weeks from today, right?
Yes, it is. is.
All right.
Wow, this month is
Fantastic.
flying.
It is flying by. So make sure you get an opportunity to win and know that that $100 donation is really a great, going to a great, great cause.
It's a great cause.
The Grand Rapids Eye Institute is located on East Paris. Really easy to find. So we appreciate you coming in and filling us in and what we can do to live better and feel better.
Well, thanks for having me.
Yeah, I learn something new from you every time you're here.
Stay with us. We'll be right back.
That's West.